Tell me what those medical expenses were for.
Some of them are for prescription. Some of them are for therapy.
A divorced father concerned over his 10-year-old daughter's long list of doctors and pills.
It's got to stop.
Whenever I see a child go to a doctor as frequently as your daughter does, bells go off in my head.
Mom wants Dad to pay their daughter's medical bills, but Dad has a very different story. He's questioning why this 10-year-old is constantly being taken to doctors, and what he says next has me questioning everything.
48-year-old teacher Judy Matson wants her ex-husband Don Marr to pay for their 10-year-old daughter's many medical bills. Marr, a computer programmer, says his ex-wife is a hypochondriac and is raising their daughter to be one.
Order, all rise. Judges number 104 on the calendar in the matter of Matson versus Maher. Parties have been sworn in, Judge. You may be seated. Have a seat, ma'am.
Miss Matson, you and the defendant were married for how long?
15 years.
And how long are you divorced?
About 3 years, 4 years.
You have a 10-year-old daughter together.
Right.
Do you have any other children?
No.
Do you, sir?
I have a stepson.
But you have no other biological children?
No.
According to your complaint, Miss Matson, your judgment of divorce provides that your former husband pay 1/2 of any unreimbursed medical bills.
Correct.
In addition to child support.
Mm-hmm.
And he does pay child support faithfully according to your answer, sir. Is
Yes,
that right?
Yes, ma'am.
How much do you pay in child support for your daughter?
$420 a month.
And according to your complaint, you have liberal visitation with the child.
About 30% of the time.
Give me the times. Is it weekends?
Wednesday, overnight, weekends, split holidays, half Christmas,
And you avail yourself of all of your visitation?
as much as I can.
Okay. Is that true?
He doesn't on all of them. The last 2-week visitation he had, he only took a week.
But most of the time he sees her every
most
week.
of the time. And he's always there on time.
Good. All right. Ms. Matson, you say that he has not paid some of the unreimbursed medical bills.
Correct.
I'd like you to tell me which bills those were.
Here, I have a summary on top so you can see. Some of them are for prescription. Some of them are for therapy, for speech therapy. Some of them are for the deductible on the chiropractic.
Well, let's talk about all these bills. These are very heavy bills without looking through them. Does your daughter suffer from any handicap?
No.
Then why does she have all of these medical bills?
These bills are over about a 2-year period. They're not just in the last 6 months.
Even so. First of all, can you tell me why the child goes to a chiropractor?
Her back hurts and her neck hurts.
Who suggested that a chiropractor was necessary for a 10-year-old child?
No one. I go every week. And she had complained for about a year about her back. And I suggested that she give the chiropractic a try. And if it didn't work, that we wouldn't do it anymore.
Why do you go to the chiropractor every week?
Because I have slight scoliosis and my back hurts, my neck hurts.
Quite frankly, Miss Matson, I never heard of anybody taking a 9 or a 10-year-old child to a chiropractor because their back hurt if it was undiagnosed by a doctor as a specific problem. Your first response should have been taking the child to an orthopedist, having a set of x-rays taken, and if it was something that had to be addressed by a chiropractor, it's addressed by a chiropractor. Let's hear about some of these other bills that you have.
There's medication for Ritalin. She's been diagnosed as ADHD.
When was she diagnosed as ADT?
She was diagnosed by her pediatrician, her therapist, by 2 separate therapists.
Which
and by
therapist?
Dr. Andrea Christensen.
When was that? How old was she when she was diagnosed with attention deficit disorder?
7.
And what prompted you to take her to a therapist?
I'm a teacher, and I work with first grade children at that time.
Mm-hmm.
And I'm aware of how children are when they don't pay attention.
So you're telling me that the child has been on Ritalin for 3 years?
Right.
Was she retested?
Yes.
When?
This last spring by her teacher.
By who?
Well, her teacher fills out a paper having to do with her ability to pay attention.
Teachers don't make evaluations with
No, they
regard
don't
to
make
whether a
evaluations.
child needs medication.
You're absolutely right. They do not. But they do report to the doctor whether the child is able to stay in her seat, whether she's able to complete her classwork, and how she is performing.
Well, I would assume that if you've had the child on Ritalin, that the child was doing fine.
Right, she is.
So if the child was doing fine, why wouldn't you want to try to wean her off the Ritalin at age 10 to see if it was a problem of short duration?
She has, from time to time, not taken her Ritalin when she's gone to school in the morning, not known to me. And I've gotten a call from the teacher that night wanting to know what was going on with our daughter and why she was so inattentive at school.
Yes.
How old was she when that occurred?
This is just this last year.
Why wasn't I informed?
Don't talk to her.
Judge Judy continues in a moment.
What really caught my attention is how many different medical concerns are coming up. We're told this 10-year-old has ADD and is taking medication because she struggles to concentrate at school. Then mom says the child was complaining about back and knee pain, so she took her to a chiropractor. And I'm sitting there thinking, a chiropractor for a 10-year-old? Now, I'm not saying children can't have genuine pain or medical problems, but when you start hearing one issue after another, it's fair to ask questions. Because at some point, you have to wonder, is this child actually sick? Or is mom turning every little complaint into another medical appointment? Dad clearly seems to think there's more going on here, and honestly, I can understand why he would be concerned. But suspicion is not proof, and that's exactly what the court has to sort out.
Cases, real people. Judge Judy. 48-year-old Don Marr says his ex-wife Judy Madsen is turning their 10-year-old daughter into a hypochondriac, and he will not be responsible for unnecessary medical bills.
Office visit Dr. Walker. Who's Dr. Walker?
And that's her pediatrician.
That's on the 5th. Is that a... We don't know what that was. That was June 5th of 96.
It was probably a check on the Ritalin.
Well, then you
Oh,
had,
you know, it's
you had
probably
another
95.
office visit. You had another office visit less than 6 weeks later, the same doctor.
She suffers from chronic ear infections and allergies. And she has had episodes of problems breathing. And at one time she had a fever over 5 days, and she was tested for valley fever. And
What kind of fever did she have over 5 days?
apparently it was a virus. But at the time, the doctor thought it might be pneumonia. She sent me
pneumonia
down.
you check by going for an X-ray.
We went and had an X-ray,
And?
it was clear. And the doctor
So?
suspected that it was
So
just...
then it was, you know, it wasn't pneumonia. If you had the X-ray, and the X-ray is clear, then you know you don't have pneumonia.
Correct.
So then it's something that goes away.
But it didn't go away in 4 days. And so...
Sometimes it doesn't go away in
Right.
4 days.
Well, and I called her back,
Sometimes it
and
takes
she
a week.
tested her for tuberculosis and valley fever, both of those.
But it went away after 5
Right,
days.
right.
So all that was really unnecessary to put the child through all of that stuff.
Well, the first initial visit was unnecessary.
The next one is May 18th of 95.
Right,
Prescription multivitamin fluoride.
right.
What is that?
It's a fluoride tab that is prescribed by her physician, supported by her dentist, for healthy teeth. Fluoride tablets that she chews after she has brushed her teeth. She has hypercalcified teeth.
Then we go to therapy, Christensen. There are several therapies that I do prior to that.
Right.
What kind of a doctor is Christensen?
She's a family therapist, and I took her initially with the divorce.
Why are you still seeing, she's still seeing this Christensen in 1996?
There has been a death in her
death of
grandfather. Her grandfather passed away, and she had difficulty dealing with that.
When was that?
That was almost a year ago, in
My
September.
father, Your Honor, died in September.
Yeah, but she's been going to see this Christensen all along. It didn't make any difference whether there was
Since
a death
August
or
of
not.
'93.
According to your bills here, it's at least every week that she goes to see this
At
therapist.
first it was. It was almost every week, but now she goes about once a month.
Ventolin.
That's for asthma.
She has asthma?
Yes.
She been diagnosed as having asthma?
Right.
Do you know anything about that, sir?
Never witnessed it, never saw it, paid for the appliances, paid for the stuff. I've never seen that little girl wheeze. I've seen her have a runny nose. That's it.
Just a second.
It's absurd. I see her a third of the time.
Just a
I
second.
should witness at least one episode. You'd think.
Ms. Madsen, I'm just reading this over because I was disturbed when I read these papers, quite frankly. And I wanted to look through your records. Let's take 1996. You have an office visit with the pediatrician on February 13th of 96. You have an office visit with the pediatrician on February 28th, 96. You have an office visit with the pediatrician on March 15th of 96. You have an office visit with the pediatrician on April 1st. As a matter of fact, there are 2 office visits listed for April 1st. You have another office visit on April 26th with the pediatrician. You have another office visit on May 28th with the pediatrician. You have another office visit on August 1st with the pediatrician. You have another office visit. No, there are none other listed here. So those are the office visits that you have with the pediatrician. All right, Mr. Maher, I'd like to hear from you, sir.
This is a patient consultant text for the 2 drugs that I refused to pay for. The Ritalin, that's the toothpaste and the vitamins. Because I believe you could use Crest and a vitamin and get bottled water, and that would go away. I believe her back problems would go away if she would stand tall, put a book on her head.
Well, you're not a doctor either. She has
No, I'm
pains.
not.
She has pains in her back. Yeah, go ahead.
A little common sense would go a long way.
Judge Judy continues in a moment. Madsen is fighting with her ex-husband Don Marr over whether he should pay half of their daughter's extraordinary medical bills. Don says Judy is turning their daughter into a hypochondriac.
What else, sir?
There's a set of bills from June 23rd, 1996 in our correspondence. And basically I refused to pay bills that were older than 30 days. She had gotten really lax. There are bills in there that are a year. This is 1 week before I'm going to see the child. I get $465 worth of bills. That's going to ensure the fact that I can't do the things I planned. So I paid 30 days and said, I'm not paying the rest, Judy. I'm not paying that, I'm not paying that, I'm not paying that. And she says, well, why not? You're the father, you're supposed to pay. And I said,
he's never
because I am a responsible parent, I can't. I mustn't pay.
What else? Because I don't think that that's what you're complaining about, sir.
No, I'm really complaining about the misuse of my daughter. I'm really complaining about taking her to this doctor and that doctor and this doctor and running her all around, and she can't be a kid. That's really what I'm angry about. And I'm angry. It's got to stop. I don't know how. Don't know how to make this stop. I think as far as the other bills...
I can think of several ways, sir, that seem to be reasonable. Do you have a copy of your judgment of divorce, either one of you?
I do.
May I take a look at it, please? This was an agreement that you hammered out between the 2 of you, I assume, either through mediation or by attorneys. Is that right?
Attorneys.
Through attorneys. You're not supposed to smile when you say that, sir. Look, I do not get the sense, Miss Madsen, that your former husband wants to be anything but a good parent to this child and wants to be remiss in his financial responsibility. I say that because he is faithful in paying his child support. He does pay for certain of her medical and dental bills. He does pay for her orthodontic bills. He does pay for other bills. I will tell you that I was concerned when I read your papers. I'll tell you why. Whenever I see a child, a young child who is otherwise healthy, go to a doctor as frequently as your daughter does and have as many kinds of prescription medications as your daughter has, even though some of them can be acquired over the counter with a little bit of imagination. When a child is taken to a chiropractor without any specific referral by an orthopedist, when it appears to me that a child is overly involved with the medical profession, bells go off in my head. I guess it's part of my training. That sometimes there's a problem not so much with the child, but with the custodial parent.
Judge Judy continues in a moment.
Honestly, I'm with Dad on this one. If this child is constantly being taken from one appointment to another, at some point you have to ask, when does she actually get to just be a kid? A DD medication, back and knee pain, chiropractor appointments, it's a lot for a 10-year-old. And if some of these medical visits aren't medically necessary, then Dad has every right to question why he's being expected to foot the bill. I don't know what's going on behind closed doors, but something about this situation definitely deserves a closer look. If Dad genuinely believes Mom is over-medicalizing their daughter, then instead of just arguing about bills, he should be asking the court to investigate the bigger picture, including whether a custody change is in the child's best interest. Because at the end of the day, this isn't about winning a fight with an ex. It's about making sure this little girl is actually okay.
I don't think that he has to pay anything for this child's chiropractor unless he was consulted and was satisfied that that was a reasonable thing and a necessary treatment for his child. Now, I wouldn't say that with all parents who come before me, because I would say, listen, he may withhold his consent, and that would be unreasonable. But because of his history of payment and of visiting the child regularly and being involved with the child, my sense is that Mr. Maher would not deny his only biological child with the necessary medical treatment that she needs. I tell you now that the reasons that you give for your daughter seeing this, continuing to see this is it Miss Christensen or Mr. Christensen?
Miss Christensen.
I am not satisfied with those reasons. I can absolutely see why a child going through a period of divorce would be served well if both parents are involved, initially and for a brief period of time, some ongoing family counseling. It's not to be used as a lifelong crutch. If you have a child who suffers from ADD, and unfortunately, I believe that that is a highly over-touted illness today. Mm-hmm. And as far as I'm concerned, the child should not be on Ritalin unless the child is tested.
She has been tested.
No. Not in 3 years, except for a teacher who writes up reports. A teacher.
No. Her therapist, she went to 2 different therapists, and her pediatrician.
A psychiatrist?
Yes.
A psychiatrist? A PhD?
No.
Show me. I'd love to see the report.
Just a second. There is nothing here. There is nothing here that suggests to me that this child saw, other than
Dr. paid the bill.
Other than Dr. Christensen, a psychiatrist, that's an MD.
That's because he paid the bill, Your Honor.
What I'm telling you is, I think any parent who keeps a child on Ritalin for anywhere near approaching a year without testing to ensure that it is absolutely necessary for this child is making a tragic mistake. Ritalin is overprescribed. 40% of kids, 12 o'clock in school today, you ring a bell, 40% of the class gets up and runs into the nurse to get their pill. And I want to tell you something. I sat in the family court for 15 years, and I was in the family court for almost a quarter of a century. And these kinds of medications are prescribed at least as often for the parents as they are for the children. That's a problem. Once you begin to believe that you can use a therapist as a crutch, and that starts as early as 5 and 6 and 7, and your child has been in therapy for 3 years, and I haven't seen any reason why. So I'm not ordering you to pay for therapy. And what I am telling you is, in the future, would be my judgment, unless it's an emergency, before you incur any medical expense that you expect him to contribute to, you discuss it with him and get his approval. And if you cannot get his approval, then the two of you sit down and decide, call up the American Medical Association, get the name of the top specialist in your area. The two of you go, have a consultation. You choose one. Choose two. Have your consultation, and let the best therapist, the best professional in the area make a judgment as to whether this medical procedure is necessary. Aside from that, I'm not ordering to pay anything. That's all.
Parties are excused. You may step out.
And in the end, Dad was ordered not to pay those medical bills. And honestly, I think that was the right call based on what we heard in court. If there are genuine concerns about whether all of these medical appointments are necessary, Dad shouldn't simply be expected to open his wallet and pay without question. But personally, I think the medical bills are only part of the bigger issue. If Dad truly believes his daughter is being over-medicalized, then he needs to stop fighting over individual bills and start asking the court to take a closer look at the child's overall situation. If the evidence supports his concerns, then yes, I think he should consider pursuing full custody. Because at the end of the day, this little girl needs a parent focused on what is actually best for her, not a never-ending cycle of doctor appointments and courtroom battles. And that's where I'm going to leave this one. What do you guys think? Was the judge right to make Dad pay nothing? Or should he have been responsible for at least some of the medical expenses? Let me know your thoughts in the comments. And if you enjoyed this breakdown, don't forget to like, subscribe, and turn on those notifications. I'll see you in the next one.